Good day, everyone. Today I will discuss with you Bloom's Taxonomy, and basically I will focus my attention on how you can use Bloom's Taxonomy to clarify your statement of intended learning outcomes. But before I present with you the taxonomy, I would like to go back to some of the categories of our intended learning outcomes. If you go back to our curriculum analysis, for example, we always start our curriculum planning or instructional planning with or by identifying professional competencies expected of our graduates. And in this particular example, we have what we call the five-star doctor. These five-star doctors, of course, help us define and also define at least the 9 major intended program outcomes. When we say program outcomes, we talk about what the students will become after or at the end of the whole degree program. And this degree or program outcomes should be the basis for formulating your own course outcome. And when we talk about course outcome, we talk about outcomes related to the end of a specific course or a subject. Let's say at the end of anatomy and the end of physiology or pediatrics. But all of these courses will have to have as its major, source of intended learning outcome, the statements of program outcomes. And from the course outcome, you will have your smaller outcomes, and they are called the session outcome or the lesson outcomes. You will notice that when you plan your courses or in instructional design, you do your instructional designing, you plan backwards. That is basically an important OBE principle, design backward. And then when you implement, you implement forward. So here, with design backward, we start from professional roles, then after that, program outcomes, then decisions on the course outcomes, and eventually on the lesson outcomes. But when we implement, of course, we implement by first achieving the intended learning outcomes for our lessons. And when we have done that, then hopefully it will help us achieve the bigger course outcomes. And all the outcomes together, course outcomes, will lead us to the achievement of the bigger program outcomes. Before we proceed, let us review Bloom's Taxonomy. You all know that Bloom's Taxonomy has 2 major dimensions, the cognitive and knowledge dimensions. Let's start reviewing the cognitive dimensions. The cognitive dimensions start from remember, followed by understand. You go up to apply, analyze, evaluate, and of course create. The first 3, remember, understand, apply, are considered the lower order thinking skills, while analyze, evaluate, and create are considered the higher order thinking skills. But you all know that to be able to remember, you need to remember something, right? And that's where the knowledge dimension played a role. To be able to remember, you need, as I said, the knowledge dimension or knowledge dimensions. And these are your factual knowledge, your conceptual knowledge, your procedural knowledge, and metacognitive knowledge. I will not discuss in detail all of these elements, but suffice it to say that you need to know them to be able to properly analyze and clarify your intended learning outcomes. Let's look at the Bloom's Taxonomy again in another perspective. And what you see here on the left side are your knowledge dimensions: facts, concepts, procedure, and metacognition. On the pyramid side, you have remember, understand, apply, analyze, evaluate, and create. As I said, you remember facts, concepts, procedures, and metacognition. You understand facts, concepts, procedure, metacognition up the pyramid. But as you go up from apply to analyze to evaluate to create, you must remember that at this particular level, what the student should actually do is integrate all the knowledge they mentioned so that they will be able to analyze, evaluate. So as shown in this slide, I embedded all the knowledge dimension in each of the levels of the cognitive dimension. But my idea of making it a pyramid is that as you go up the higher taxonomy level, you integrate much more the concepts that you remember, the concepts or the knowledge that you understood, and the procedures that you are applying so that you can do something at the higher order thinking skills. So let us now use what we reviewed in the last few slides in analyzing cognitive and knowledge dimension of intended learning outcomes. Let's use as an example management of patient with hypertension as a topic. Using an OBE framework, we always start from the highest order thinking. So let's start by filling up the first column or the last column on the right. So you have follow-up plan, management plan. Remember, I did not put any verb at this particular point. Just the concepts. So says evaluate at the conceptual knowledge level status of patient. Example type of hypertension. Analyze patient BP for the last 3 months. BP, take BP from real patients. Understand differences between normal and abnormal values. How BP taking equipment works. You have to differentiate this from steps in taking blood pressure. And at the remember dimension, you have normal BP values, anatomy of cardiovascular system, blood pressure, hemodynamics, how to take BP using aneroid sphygmomanometer. But let us not also forget that there is still the missing metacognitive knowledge dimension. So at the create level, you have personal plan to master competencies. But to create a plan, you need to be able to evaluate your own performance level, and you, in the evaluation of your performance level, will be dependent on the analysis of the errors in the performance of the procedure, which you were able to identify by assessing your own performance. So you take a BP from real patient, you assess, but of course, the only way for you to assess your own performance is to know exactly what are the most or the appropriate steps or the correct steps in performing blood pressure taking using an aneroid sphygmomanometer. Statement of outcomes. As I said in the statement of outcome, you just need to add a verb or the verbs appropriate for the particular dimension. Let's say from the create, we bring down the follow-up plan. Let's add a verb to that, and now the statement will be at the end of the module. Students will be able to formulate a follow-up plan or prepare a management plan for a patient with a certain type of hypertension. And on the metacognitive side, you can convert as an ILO, the one in the bottom, prepare a personal plan to master related competencies. Break it down further, let's focus at this point to preparing a management plan. And to be able to prepare a management plan, you need to evaluate the patient, right? So you bring that evaluate there, and let's formulate a new ILO. So given patient's BP history, we'll be able to classify patient as to type and stage of hypertension. We bring down the analyze. So given patient will be able to collect BP history, and of course take a BP using sphygmomanometer accurately. Let's add the verb coming from the understand and remember dimensions. So let's start with the understand dimension. We bring down the difference between normal and abnormal values, how BP taking equipment works, and add verbs to them, and let's say what we will have now will be explain the difference between normal and abnormal values. Discuss how a BP taking equipment like sphygmomanometer works. And let's bring down remember and now add verbs to them. So our statement will be give the normal BP values, list the anatomical structure, discuss blood pressure, define hemodynamics, enumerate the steps in taking BP using aneroid sphygmomanometer. So now you have appropriate verbs for each dimension, and now you have a complete set of outcomes. Technically, we're able to produce 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, almost 12 outcomes based on the analysis that we did of the Bloom's Taxonomy matrix. Thank you and have a good day. I hope you will enjoy writing your intended learning outcome.